Swayam Prabha. Digital India. Educated India.
Good morning. I am Dr. Pushpalata K, Professor and HOD of Anatomy, JSS Medical College, JSS Academy of Higher Education and Research, Mysore. Okay. So, today in this session, we will discuss about the gross anatomy of the Pons. So, why is this Pons important? Okay. So, here we have a history where a 55-year-old male patient comes with a history of sudden onset of dysarthria and appendicular ataxia, then right hemibody weakness and blurred vision, and he was a smoker. On examination, he had a horizontal left gaze palsy with horizontal nystagmus. MRI of brain showed a small lesion in the left median pons. Okay. So, after this session, let us see what is the anatomical basis for these signs and symptoms. Okay. So, why this studying pons is important, we will know after the end of this session. So, learning objectives for this session is: describe the external features of pons, describe the internal features, that the transverse section of pons at upper and lower level, describe the cranial nerve nuclei in pons with their functional components, describe the blood supply of pons, and discuss the clinical anatomy of pons. So, as we know, the pons is a bridge between the midbrain and the medulla. Okay, and also it transmits the information from the spinal cord and with the higher part of the brain parts, and it acts as a motor relay station for the motor information between the cortex and the cerebellum. So, this connects between the midbrain and the medulla, as well as the information connection between the cortex and the cerebellum. Okay. So, now the pons, as we know, pons means a bridge. Okay. It is almost 2.5 centimeter length. Okay. It is also called as a metencephalon. It is present on the clivus in the middle cranial fossa. Okay. And here you can see it is the posterior surface, it forms the floor of the fourth ventricle. So, anteriorly pons and medulla and posteriorly cerebellum forms this fourth ventricle. So, the posterior part of the pons is related to the fourth ventricle. Okay. So, now let us see the external features of pons. Okay. So, it has got a ventral surface and a dorsal surface. Okay. And there is a superior border that is between the midbrain and the pons, and the inferior border between the pons and the medulla. And you can see the surfaces are striated because the cerebellopontine fibers, they cross over and go to the opposite cerebellum. So, that you can see here the striations. Okay. Now, coming to the ventral surface. So, you can see in this image, in the ventral surface, there is a sulcus. Okay. The longitudinal sulcus, that is called as a sulcus basilaris. Okay. This lodges the basilar artery, and this pons is connected to the cerebellum through the middle cerebellar peduncle. Okay. So, here you can see the middle cerebellar peduncle. On either side, it is connected to the cerebellum through the middle cerebellar peduncles, where the cerebellopontine fibers, they run through this peduncle. Okay. And at the junction between the pons and the middle cerebellar peduncle, we can see there is a root of the trigeminal nerve is attached. Okay. So, at the junction between the peduncle and the pons, there is attachment of the trigeminal nerve. Okay. And there is the inferior border, or we call it as the horizontal sulcus, that is the pontomedullary junction. Okay. So, this pontomedullary junction, it lodges the cranial nerves, that is when you go from medial to lateral, you have the sixth, that is the abducent nerve, then we have the facial, then vestibulocochlear nerve. Okay. So, from medial to lateral, sixth, seventh and eighth cranial nerves are attached at this pontomedullary junction. Another important feature, okay. So, what is important here is that is the CP angle, okay. So, this is the CP angle, that is the cerebellopontine angle, okay. So, this cerebellopontine angle is very, very important clinically, because so many structures is the junction between the pons, cerebellum and the medulla. So, as we see, the lot of cranial nerves are attached here, and the cerebellum is there, and pons and medulla, and the cerebellar peduncle is there. So, any tumor pressing at this area, it causes a lot of clinical importance it has got. So, that produces CP angle syndrome, okay. So, this is the ventral surface. Now, let us see what is there in the dorsal surface. So, you can see here in the dorsal surface, as I said, this forms the floor of the fourth ventricle, okay. So, here in the middle you can see there is an elevation, this is called as the facial colliculus, okay. So, this is the facial colliculus, this is produced due to the facial nerve and the abducens nerve which is present here, they forms the facial colliculus, okay. And here you can see there is a sulcus limitans, this separates the sensory from the motor area, okay. And there is a, here this area is called as a vestibular area, because the vestibular nucleus is present, okay. And here in the sulcus limitans, here, okay, at this they are called as a superior fovea, and here the discolorated area, that is called as a locus ceruleus. So, this is what we see on the dorsal surface, mainly it forms the floor of the fourth ventricle, okay. Now, let us see the internal features of the pons, okay. So, internal features when we see here, so you can see in the center there is a trapezoid nucleus and the trapezoid body, okay. So, this separates, okay, or this is the junction between the ventral part, that is called as the basilar part, and the posterior part is called as a tegmental part, okay. So, this is the basilar part is nothing but the continuation of the pyramid of the medulla, okay. The rest of the medulla continues as a tegmental part, okay. So, anteriorly it is the basilar part and posteriorly is the tegmental part, okay. And this basilar part is nothing but the continuation of the pyramidal tract, and the rest of it continues as a tegmental part. And this basilar part is common throughout the pons, but whereas this tegmental part, there is a variation in the tegmental part. So, that we will see what it is, okay. Now, coming to the basilar part, okay. So, in the basilar part, you see there is a, you can see there is a fibers running here, okay. So, they are nothing but the, as I said, it is a continuation of the pyramidal part of a medulla. Here you see there is a cortico-nuclear fibers, corticopontine fibers and corticospinal fibers, okay. This cortico-nuclear fibers, it is from the cortex, okay, and it comes through the pontine nucleus and they connected with the cranial nerve nucleus. It is for the coordination of the head, neck and with the eye and the ear movements. So, it coordinates with this cranial nerves with the cortex, okay. And this corticopontine fibers, okay. So, from the cortex they come to the pontine nucleus here, okay, then go to the cerebellum. So, this acts as a bridge between the cortex and the cerebellum through the corticopontine fibers, okay. And another important one is the corticospinal fibers, okay. So, that is the from the cortex it is going descending, then it crosses at the pyramid and goes to the opposite side of the body. So, that is the corticospinal fibers. So, these knowing these what are the structures present is very, very important, because when the patient presents with some of the clinical symptoms, we need to identify or locate where is the lesion, okay. Then another thing what we see is here you can see there is a in between these fibers. So, there is a pontine nucleus are present, okay. So, this pontine nucleus, okay, connected with the cerebellum through the pontocerebellar fibers to the opposite side, okay. So, these fibers, the corticopontine fibers relay in the pontine nucleus, go to the opposite cerebellum through the pontocerebellar fibers through the middle cerebellar peduncles, okay. So, here it is As I said, it is a connection between the cortex and the cerebellum for the precision coordination of a voluntary movement. Okay. So, for coordination of voluntary movements from the cortex to the cerebellum, this connects. Okay. Then in between, posterior to that, you see there is a trapezoid body. Okay. And this is the basilar part, and this is the common for throughout the pons. Okay. Now, let us see. Okay. So, tegmental level, as I said, the basilar part is same, but the tegmental level, there is a difference at the two levels. Okay. First, we will see at the facial colliculus, that is the lower level. Okay. The facial colliculus. So, what are the structures we see here? Okay. So, here you see there is a medial longitudinal fasciculus. Okay. So, just behind this trapezoid body, you see there is a medial lemniscus. Okay. So, this medial lemniscus is nothing but which is carries the fibers from the nucleus gracilis and cuneatus. Okay. So, these fibers, when they come to the pons, they rearrange themselves from sagittal to the coronal, where the cuneate fibers becomes medial and gracilis fibers becomes lateral. Okay. Then lateral to that, what we have is the spinal lemniscus. It is nothing but the continuation of the lateral spinothalamic tract. Okay. So, then we have in the median plane, what we have is the medial longitudinal fascicle, okay, tectospinal, okay, tract, and the rubrospinal tract. This medial longitudinal fascicle is nothing but the ascending and descending fibers of the vestibular nuclei. Then we have is the tectospinal tract, that is from the tectum of the superior colliculus to the spinal cord. This is for the visual coordination between the spinal cord and the, because going from the tectum of the midbrain. Then is the rubrospinal tract from the red nucleus to the spinal cord. Okay. So, these are the median position. Okay. You see these three white matters. Now, next what we see is the grey matter. Okay. So, where you see there is a spinal nucleus, so the tract of the trigeminal nerve. Okay. And then we have the abducent nerve nucleus. Okay. You can see the abducent nerve nucleus with the abducent nerve. Then we see the facial nucleus, the motor nucleus of the facial nerve with the facial nucleus with the facial nerve, which emerges through this basilar part. Okay. And here you can see the motor nucleus of the facial nerve, actually, which is first there is it is a dorsolateral to the abducent nucleus. Okay. Then what happens, it is winds around this abducent nucleus. Okay. Then it comes to the ventrolateral position. Okay. It comes to the ventrolateral position. So, this is the motor nucleus is searching for the sensory component. Okay. Which was ventrolateral, becomes winds around this, comes to the ventrolateral and the present position, which is actually close to the sensory nucleus of the trigeminal nerve. So, this process of motor component searching for a sensory is called as a neurobiotaxis. Okay. So, this is the neurobiotaxis. Then another what we see is the vestibulocochlear nucleus. Okay. The ventral and dorsal nucleus of the cochlear nerve and the vestibular nucleus. The vestibulocochlear nerve also is seen at this region. So, this is the facial colliculus. So, this the winding around this facial nerve over the abducent nucleus forms this elevation in the floor of the fourth ventricle, that is called as a facial colliculus. And another nucleus what we see here is the superior olivary nucleus. Next, we will see the tegmental cross section at the little rostral level. Okay. So, here this level is passes through the principal sensory nucleus and motor nucleus of the trigeminal nerve. Okay. And here there is, you can see there is a fourth ventricle is seen. Okay. It is roofed with the superior medullary velum. Okay. And here here you can see the, as I said, the basilar part is same. Okay. You can see here just behind this trapezoid body, you can see there is a coronally oriented lemniscus. Okay, as you know, there is a medial lemniscus, then there is a trigeminal is added here, that is from the trigeminal tract, then the spinal lemniscus is lateral to this, that is, as I said, it is a continuation of the lateral spinothalamic tract, okay, and the lateral lemniscus, this is from the cochlear part, that is the auditory pathway. Okay, and the important what we see here in the median plane, again it is the medial longitudinal vesicle, tectospinal and rubrospinal tract you see, and you see here is the superior cerebellar peduncle in the dorsolateral part. There is appearance of the section of the superior cerebellar peduncles. So, this superior cerebellar peduncles carries the fibers from the cerebellum to the tectum and from the red nucleus. Okay. So, this carries the fibers from the rubrocerebellar fibers or passes through superior cerebellar peduncle. Okay. Now, what we see is there is a, I said it is a at the level of the trigeminal nucleus, you see there is a motor nucleus of the trigeminal nerve, laterally is the sensory, the principal sensory nucleus of the trigeminal nerve, and the fibers from the mesencephalic root of trigeminal nerve is also coming along with this and forms the trigeminal nerve. Okay. So, till now what we have studied is, okay, so you know the pons is a bridge between the midbrain and the medulla. It has got a ventral surface and a dorsal surface, superior border and inferior border. In the ventral surface, we see there is a sulcus bacillaris, okay, and there is a middle cerebellar peduncle. Then there is a trigeminal nerve is attached, okay, with the junction between the middle cerebellar peduncle and the pons, okay, and there is a CP angle, where that is the cerebellopontine angle, where all these three structures, that is the pons, medulla and cerebellum meet. Okay, and here you can see this is at the level of the facial colliculus. In the, it is divided in the internally, when you see the ventral basilar part, it is a continuation of the pyramidal tract. Okay, and there is a trapezoid body just ventral to that, you see that the dorsal to that there is a trapezoid body. Dorsal to that, what you see is the medial lemniscus and spinal lemniscus. In the median region, you see the middle longitudinal fasciculus, tectospinal and rubrospinal tract. Okay, and at this level, we see there is a trigeminal nerve nucleus with the tract. Then you see the abducent nerve nucleus. Okay, and there is a facial, the motor nucleus of the facial nerve, then vestibulocochlear nucleuses, and there is a superior salivatory nucleus. This is at the level of the facial colliculus. Okay. Another level is just rostral to that, where the basilar part it is same. Okay, just dorsal to that there is a added is the trigeminal lemniscus and lateral lemniscus added, and in the median position they are the same. Fibers are running, that is the medial longitudinal fascicle, tectospinal and rubrospinal, and there is appearance of the fourth ventricle here roofed by the superior medullary velum, and there is appearance of the superior cerebellar peduncle with the trigeminal nucleus. Okay, so this is what we see the little rostral level. Okay. Now, we have studied the gross anatomy, what are the external features, what are the internal features, what we see. Now, let us see what are the cranial nerve nucleus present in the pons. Okay. So, we see the motor nucleus, what are the motor nucleus present in the pons? You have the nucleus of the trigeminal nerve, okay. Then there is the abducent nerve nucleus, okay, and the motor nucleus of the facial nerve. Okay. Then the sensory, what we see is the principal sensory nucleus of the trigeminal nerve, actually it extends, okay, from the medulla, pons, and it also goes till the midbrain. Okay. And there is also the vestibulocochlear nuclei which is present almost in the pons as well as little bit in the medulla it is seen. Okay. So, these are the nucleus what we see. So, what are these nuclear, the functional component of this? Okay, now let us take the trigeminal nerve. I said the trigeminal nerve has motor component and sensory component. This motor component is the special visceral efferent component. Okay, so that means special visceral means it supplies the muscles derived from the branchial arches, the pharyngeal arches. Okay, so that is the muscles of mastication. Then the sensory component of this trigeminal nerve is the general somatic afferent, which carries the touch and pressure from the face. Okay, so the trigeminal nerve has both motor as well as sensory component. Now coming to the abducent, the motor component is the general somatic efferent. Okay, that means it supplies the lateral rectus muscle. Okay, now coming to the facial, and again the facial has both motor and sensory. So this motor part of the facial nerve is the, again it is a special visceral efferent. This supplies the muscles derived from the second pharyngeal arches. Okay, so that is the muscles of facial expression. Okay, so that's it, the special visceral efferent. The sensory component is the superior salivatory nucleus. It is a general visceral efferent. It supplies the submandibular, sublingual, nasal and lacrimal glands through the submandibular ganglion. Okay, so that is the sensory component of the facial nerve. Both this vestibular and cochlear nerves, that is the special somatic afferent. Okay, so they carry the fibers. The vestibular nerve carries the fibers for the equilibrium, and cochlear nuclei or the nerve carries for the auditory fibers. Okay, so this is the functional components of the cranial nerve which is present in the pons. Okay, now let us see. So it has got lot of important structures. What is the blood supply it receives? Okay, it mainly receives the blood supply from the basilar artery, okay, and anterior inferior cerebellar artery. These are the two main arteries which supplies blood to the pons. Okay, you can see this is the basilar artery. Okay, so it is formed by the this vertebral artery combined together, join and forms the basilar artery at the lower part of the pons. Okay, then it is lodges in this groove where it gives the minute pontine branches. Okay, so you can see there is a minute branches, they are the pontine branches. Okay, and the venous drainage, they go into the inferior petrosal sinus and basilar venous plexus. Okay, let's study in detail how these arteries they supply. Okay, I said the basilar artery gives a pontine branches. Okay, so it gives a paramedian branches which supplies the paramedian region. So you know what are the structures at the paramedian region? Okay, so the medial longitudinal fascicles, tectospinal and rubrospinal. Then you have the medial lemniscus and there is a spinal lemniscus. Okay, at the lower part. And in the basilar part, you have the main component, that is the corticonuclear and corticospinal fibers are running here. Okay, so this paramedian fibers, this is supplied by the paramedian branches. Okay, and also it supplies the periaqueductal grey matter. Okay, then we have another branch that is called as the circumferential branches. Okay, that means as we know, circumferential means it winds around the pons. Okay, so again this circumferential, we have a long as well as the short branches. So these circumferential branches supplies the lateral pons, okay, then the middle cerebellar peduncle, then floor of the fourth ventricle and the lateral part of this tegmentum of the pons. Okay, so this, the median portion is by the paramedian branches of basilar artery. Lateral part of the whole thing is supplied by the circumferential branches, both short as well as the long circumferential branches. And we know this anterior inferior cerebellar artery is a branch. As soon as the basilar artery is formed at the lower part of the pons, it gives a branch, that is the anterior inferior cerebellar artery, and this supplies only the lower pontine areas. So that is the anterior inferior cerebellar artery. Okay, so here in this image what we can see is the number 1, what is shown here. Okay, as you go from caudal to the rostral level. Okay, so you can see what are the structures also present. So let us correlate. Okay, so here the paramedian branches, the area number 1. Okay, so where here this the area number 1, what is shown here is supplied by the paramedian branches of basilar artery. Okay, and the lateral, okay, or the posterolateral area is supplied by the long circumferential branches of basilar artery as well as the anterior inferior cerebral artery. The number 2 what is written here and this, that is the dorsolateral or posterolateral part of the pons. Okay, so we can, this area is supplied by the long circumferential branches both from basilar as well as anterior inferior cerebellar. And what you see here, the number 3 what is written, that is anterolateral area of the pons, okay, that is supplied by the short circumferential branches of basilar artery, okay. And the area number 4, the most posterior part, okay, so what is shown in the dot here, the number 4, that is supplied by the long circumferential branches of basilar as well as it also receives from the superior cerebellar artery. Only this area receives from the superior cerebellar artery, especially where you have the superior cerebellar peduncle, that area is received from the long circumferential as well as the superior cerebellar artery. So, till now what we have studied, okay, we have studied the gross anatomy of the pons, where it has got an anterior surface, posterior, or we call it as a ventral and dorsal. You can see there is a middle cerebellar peduncle connects the pons with the cerebellum. Then the trigeminal nerve is attached at this junction. Then there is a CP angle, and the what we studied, the cross section, that is the interior of the cerebellum, interior of the pons, and the ventral part is the basilar part. It is nothing but the continuation of the pyramid of the medulla, okay, and at the this posterior is called as the tegmental part. In the tegmental part, at the level of the facial colliculus, you see there is a medial lemniscus and only spinal lemniscus. Then in the median region, you see the white fibers as medial longitudinal vesicle, tectospinal and rubrospinal. We see the nucleus of the trigeminal nerve, okay, nucleus of the abducent, facial nerve nucleus, vestibulocochlear nucleus and superior salivatory nucleus. Okay, little rostral level, all the same, except there is a trigeminal lemniscus is added here and there is a lateral lemniscus is added, and there is a cavity of the fourth ventricle. It is roofed by the superior medullary velum, and there is appearance of the superior cerebellar peduncle and the nucleus of the trigeminal nerve, both motor and sensory nucleus is seen. Okay, and the cranial nerves, what we see here is the motor nucleus of the trigeminal nerve, motor nucleus of the abducent, motor nucleus of the facial nerve, salivatory nucleus, both superior and inferior. Then there is a sensory nucleus of the trigeminal and vestibulocochlear nucleus. And it receives the blood supply mainly from two arteries, that is the basilar artery and anterior inferior cerebellar artery. The paramedian region is by the paramedian branches. The lateral area is by the circumferential branches, both short as well as the long circumferential branches. Now let us see the case. Now we have studied the anatomy, the interior of the pons. So now let us see how these symptoms or why it is important to study the pons. Okay. So here there is a patient, male patient with 55 years old, comes with a history of sudden onset of dysarthria and appendicular ataxia. So why is this dysarthria and appendicular ataxia? We know because there is a cranial nerves are involved and there is an involvement of the ataxia, means it is related with the cerebellum. So there is, you see the pontocerebellar fibers and right hemibody weakness. That is mainly because it is the affected is the corticospinal fibers, and there is a blurred vision is there because there is the fibers which is going, the visual fibers are affected, and there is abducent nerve is there that is affected. And as we know, it is a probably because history of smoking is because there is a any blockage of these arteries can be happen there, and there is a horizontal left gaze palsy with the horizontal nystagmus, that is because of the involvement of the cranial nerves, that is 7th and 8th cranial nerves. So there is a brain showed a small lesion on the left median pons. Okay, so this is the why the anatomical basis for this is the because involvement of the median region and the cranial nerve nucleus are present. So he presents with all these signs and symptoms. Okay, so what is the other importance of this is the anteromedial there is an infarction. Okay, you can see there is anteromedial infarction. Okay, this causes the hemiparesis, okay, or we call it as a hemiplegia. Okay, and contralateral ataxia, because the cerebellopontine fibers go to the opposite cerebellum. So, there is a contralateral ataxia and there is a dysarthria and there is a nystagmus, okay, and often there is a ipsilateral facial palsy, okay, if there is any anteromedian infarction. Okay. So, this area where the pons harbors the descending motor fibers, nucleus of the 6th and the 7th cranial nerves and pontocerebellar fibers. So, this how this area is, and also we know this is supplied by this artery. So, if the patient present with these symptoms, we need to locate, so the lesion in the paramedian, so what is the artery supplying there. Okay. And as I said, the importance of this CP angle. Okay. So, if there is any tumor which is pressing here at the CP angle, so this presses on the inferior and the middle cerebellar peduncles. Okay. Then there will be involvement of the spinal lemniscus. Okay. Then the spinal tract of trigeminal nerve and 7th and 8th nerve also affected. Okay. So, because of this, so the patient might present with the tinnitus, deafness and vertigo, because there is involvement of the 8th cranial nerve, that is the vestibulocochlear nerve, and he can also have an intentional tremor, dysmetria and ataxia, because there is a involvement of the cerebellum. Okay, you can also present with the loss of pain and temperature of the face of the same side, okay, because of the involvement of the spinal trigeminal tract. And also on the opposite side, there is a loss of pain and temperature of the face and forehead due to the involvement of the spinal lemniscus. Okay, and also he can present with the lower motor neuron lesion, then hyperacusis, because the facial nerve supplies the stapedius, and also the loss of taste in the anterior 2/3 of the tongue, all this because of the symptoms of the facial nerve. So, if there is any tumor at this region, if the patient presents with so many symptoms, we need to think there is a pathology at the cerebellopontine angle. Okay, then occlusion of this paramedian short circumferential branches, okay, of basilar artery, where it involves the 6th and the 7th nerve and the pyramidal tract. These are the short circumferential branches. Okay. So, this leads to two syndrome. One is the Raymond syndrome, another is the Millard-Gubler syndrome. Okay. What is this Raymond syndrome is? As we know, it is the involvement of the paramedian region. It involves the 6th and the 6th nerve and the contralateral hemiplegia because of the involvement of the corticospinal tract. So, this is called as a Raymond syndrome. Okay. So, if it involves only the 6th nerve and corticospinal tract, we call it as a Raymond syndrome, where there is a ipsilateral paralysis of the lateral rectus and contralateral hemiplegia. Okay. Same thing if this affects the facial nerve and the contralateral hemiplegia, that is the corticospinal tract involvement, we call it as a Millard-Gubler syndrome. Okay. So, looking at this, whether it is an involvement of the lateral rectus or the facial palsy, you can call it as it is either the Millard-Gubler or a Raymond syndrome. So, looking at these, we need to differentiate where the lesion is. To summarize, okay, what we have studied is the gross anatomy of the pons. Okay. Pons has got a ventral surface and a dorsal surface. Okay. And at the interior, when you see the ventral basilar part, okay, and dorsal tegmental part, okay, that is a trapezoid body is differentiate the basilar part and the tegmental part. This basilar part is nothing but the continuation of the pyramid of the medulla, and this rest of the medulla continues as a tegmental part. Okay, and this basilar part, we also see the important fibers, okay, that is the corticonuclear fibers, corticospinal fibers run in the basilar part, and also the pontocerebellar fibers, okay, that from the cortex the fibers come relay in the pontine nucleus and then go to the opposite cerebellum. Okay, that is the pontocerebellar fibers, and this basilar part remains same at all the level of the pons. Okay. Just dorsal to that, you see there is a trapezoid body. So, in front of the trapezoid body, we see the medial lemniscus, okay, and you see lateral to that there is a spinal lemniscus. Okay. In the median region, we see there is a medial longitudinal fascicles, tectospinal tract and rubrospinal tract. Okay. So, at the level of the facial colliculus, we see the nucleus of the trigeminal nerve, nucleus of the abducent, nucleus of the facial nerve, superior salivatory nucleus and dorsal and ventral nucleus of the cochlear and vestibular nucleus. This is at the level of the facial colliculus. Little rostral level, we see there is an appearance of the fourth ventricle, okay, with the superior medullary velum, then appearance of the superior cerebellar peduncles. The paramedian, this remains the same, and even the basilar part remains the same, except here in the coronally oriented, you can see the four lemniscus, that is the medial, trigeminal, spinal and lateral lemniscus, and this level is at the level of the nucleus of the trigeminal nerve. You see there is a medially motor nucleus is placed and laterally sensory nucleus of the trigeminal nerve. And the pons is mainly supplied by the basilar artery and anterior inferior cerebellar artery. Okay. So, this basilar artery gives the paramedian branches. This supplies the paramedian area, and the short circumferential branches supplies this lateral area, that is where the corticospinal fibers there on the basilar part, and the long circumferential branches supplies the lateral as well as the posterior part. And this anterior inferior cerebellar artery supplies the lower part of the pons. Okay, and the venous drainage, it goes to the inferior petrosal sinus and the basilar plexus. Thank you.